Like to yield 5 minutes to the Congressman from Kansas, Mr. Huelskamp.
Thank you, Mr. Chairman. I appreciate the opportunity to visit here and learn much more about this topic. And my first question would be for Ms. Frick, and thank you for being here. How many years of background do you have in this industry and your education that qualifies you for your current position?
Sure. So I've been in the industry ever since I graduated from college, basically. So a little over 14
2
years.
years ago? Okay.
Yeah, about 5. Thanks. And I have been active just from the perspective when I started my career, I started out with an insurance consulting firm and just started asking a lot of questions and moved from the small group space and fully insured into our client size was into the middle market space, starting to get a mix of self-funding and then to a larger self-funded market space. I was curious. I asked a lot of questions. I like to learn it, and if I need to educate you about it, I need to know what I'm talking about. I worked with a managed care company for a year, so I had a very interesting and in-depth look on the inside from how an HMO itself functions. I had a very good relationship with the underwriting actuarial department, so now I really understand how rates are calculated. What is the value of a copay? What is the value of the deductible and out-of-pocket? And then from then back on the consulting side.
And last week in a hearing, for instance, the HHS Secretary did admit a felon could serve as a navigator potentially. How comfortable would you be to call up a navigator or visit with them in order to make your health care decisions?
Honestly,
Yes.
Not comfortable at all. Unless I knew that they were a licensed, regulated entity that had to conform to continuing education as we have to a required number of hours every 2 years, and we are subject to market conduct and are held legally accountable for what we do, what we say. We carry E&O insurance. We have, for any claim against us. I want to know that the person I'm talking to on the other line knows exactly what I'm talking about or asking the questions for. I appreciate if someone doesn't know and is honest and say, I don't have that answer, but I'll find out for you. But I would much rather, if I'm making a big healthcare decision, just as an employer, as an individual, this is your number 2 for an employer payroll. This is the number 2 list on your accounting statement. You've got to know who you're talking to and who you're dealing with, and they're going to be able to be objective in helping you determine what's best for you.
Okay, well, thank you. I share that concern as well, hearing that from constituents worried about instead of the agent they usually rely on or the folks that help manage their account at their employer, just worried about a navigator, untrained, perhaps for a month, not even that, no E&O insurance. I hadn't even thought about that. I mean, that's just a basic requirement for the agents. The second question would be for, I believe, for Mr. Ferguson. I'm looking at a story from my district in Kansas, Salina, which is about the middle of the country, and a company by the name of Vortex Corporation. They worked really hard. Their insurance renewal date was just happened to be July 1st. And they worked really hard and made that requirement, did everything they needed to do, and then shortly thereafter, the administration announced, you know what, we're just going to ignore the portion of Obamacare that says the business mandate. We're going to put that off. So, other companies, were they in this situation? And what's been the impact of delaying that? I've heard various reports of what that has meant for businesses, and if you could provide some light on that, Mr. Ferguson.
Well, I assume you're referencing companies that currently maintain a plan and are determining whether to continue that plan through 2014. Is that the direction?
Yes, in this case, the renewal was July 1st.
Right.
And they worked everything they could in the law, and all of a sudden it was suspended for a year or whatever.
Yeah. Well, what I can simply tell you is anecdotal, so disclaimer there, and the companies that I've spoken with is that all of the companies that provide or are thinking of providing a group health plan, they've run the numbers, so to speak. They've done the analysis in terms of whether they want to start a plan or maintain a plan, and they've probably reached some initial conclusions as to whether they want to play or pay. But most of those companies are taking a wait-and-see attitude, particularly the ones that are thinking about that they might drop the coverage and go ahead and pay, because they're kind of waiting to see what exactly how is the experience in the exchanges going to be. For instance, for companies that would be considering potentially dropping their coverage, one of the things that they're looking at is, okay, are the exchanges, are they going to be functional? Are they going to be effective? Because that's going to impact the decision of the employer. If they're thinking, well, if my assumption is that I could drop my coverage and there's a viable option for my employees, and it's easy, and you can get your affordable coverage as the law anticipated through the exchanges, that might influence my decision to go ahead and drop my plan. On the other hand, if there is uncertainty in the marketplace and the exchanges are not delivering on that promise, then that would sort of push them back to maintaining the plans. I think if you talk to most companies that are self-insured, that have run successful self-insured programs, their preference is to keep their plans, just because for no other reason. It's a value to them. It's a value to retain and attract talent. So for those successful plans, they're inclined to keep them. But they've all run the numbers. They've all had their initial analysis. Most of them, if not all, will not publicly state what their intentions are. But in some back room, they have a spreadsheet that shows all the different variations. And again, as I said, a lot of them are just sort of waiting to see how. Obviously, there's a lot of uncertainty that's going on in the marketplace right now. So they're kind of waiting to see how this all plays out.
All right. Thank you, Mr. Chairman.
Thank you.